So, how do we go about diagnosing patellofemoral pain syndrome? Well, first and foremost, you look at the history. Like I said previously, this is a condition of overuse, right? So, folks will typically say, I started some sort of new activity, right? Maybe that's running, maybe that's weight training, something that stresses the patellofemoral joint, and you get some pain, all right? And this could be with a spike in training or maybe just a new activity potentially. So if all of a sudden you start doing more mileage, okay, or you increase the intensity with your running, maybe you add another day of Olympic weightlifting or squatting into your program, and you'll find that gradually the knee starts hurting and it gets worse over the course of time. Okay. Can this happen kind of all of a sudden? Sometimes. Yeah, sometimes. But generally, it's a gradual onset. People don't always remember what caused it. And they sometimes have no idea what ended up being the catalyst to create this injury over the course of time, is in they can't recall, okay, it was an increase in running volume or anything like that. Sometimes it's just insidious and they have no idea why it occurred, right? It's usually not traumatic. What additional criteria can kind of help you point to a patellofemoral issue? So if you're hearing crepitus or grinding behind the knee during knee flexion movements, or the patient is telling you they're getting some crepitus or grinding behind the kneecap, that's a sign maybe you're dealing with patellofemoral pain. If the individual says they have pain with sitting, or pain rising from a seated position, or if the knee hurts straightening after sitting for a prolonged period, this may roll in some patellofemoral pain. These folks will typically have something called a movie theater sign, not all of them, which is basically when you sit down for a long period of time. So imagine you're watching a movie, which is usually a few hours, right? The knee just starts hurting. Okay. The idea is that if you sit with a flexed knee, your quad and patella down to the patellar tendon where it attaches onto your tibia, the tib tuberosity, forms a strap that will compress the patellofemoral joint. And if you sit in that compressed position for a long period of time, it can create some irritation, right? Or just tell your body, hey, get up and move. The patellofemoral joint doesn't like this, right? That's a movie theater sign. What kind of subjective information might your patient tell you? Well, really, in patellofemoral pain, anything that aggravates the knee joint when you load flexion could be a patellofemoral issue, right? So things like squatting, stairs, jogging, running, hopping, and jumping can all aggravate the patellofemoral joint. In my world, so I work with a lot of Olympic weightlifters, strength and fitness. Squatting typically hurts. The Olympic lifts usually hurt. It usually hurts as you descend deeper into a squat. Sometimes, if the patellofemoral joint is irritated enough, things like jerk dips will hurt. Or in a split jerk, the front side leg will get irritated because you're basically in a lunge position when you catch the weight. Lunges and step ups in general can be pretty irritating. You'll also find that deadlifts feel better than squats if folks have the patellofemoral pain. What about objective measurements? So you're going through your evaluation and you palpate the knee and you notice some tenderness on the facets on the side of the patellofemoral joint. This could be a sign you're dealing with patellofemoral pain. Usually you won't find any effusion, but you might find a little bit around the patella. If there's larger effusion, it indicates something else going on, right? You'll also generally find normal range of motion passively. So if I lay on your back and I fully extend the knee and I fully flex the knee, it should be the same as on the other side, and it shouldn't be painful. Okay. How about manual muscle testing? Well, in folks that have patellofemoral pain, they generally have weak hip abduction, extension, and external rotation. Now, keep in mind, this is after you already have patellofemoral pain. For whatever weird reason, folks that have patellofemoral pain didn't normally have hip abduction, external rotation, and extension weakness prior. This all occurs after you have the injury. Okay. The other thing you may find is weakness in knee extension. And oftentimes this is painful. So anytime you flex the quad, especially with the knee bent, you're going to load the patellofemoral joint. If you've got some irritation behind the kneecap, it might hurt. And people with patellofemoral pain syndrome have been shown to have a 6 to 12% deficit in strength compared to healthy controls without patellofemoral pain. Okay, so expect that quad to be a little weak. How about special tests? Do we have any good special tests to help rule in patellofemoral pain? Well, first and foremost, we don't really have a gold standard in order to diagnose patellofemoral pain. So when you do an MRI or an X-ray of the knee, that doesn't help to rule in patellofemoral pain. Okay. So we don't really have a gold standard to measure on. So there's no good sensitivity or specificity reporting for any of these tests. But there's a few you can use with your clinical reasoning process if you're having trouble figuring out what's going on. One's the femoral grind test. So the patient lies on their back, relaxes the knee, and then the practitioner, so me, takes their hand and I'll press directly down towards the table over top of the kneecap, and I'll ask the patient to contract their quad. And you notice painful crepitus, so the patient says, yeah, that reproduces my same knee pain, then that's a sign that you're dealing with some patellofemoral pain. All I'm doing is engaging the patella into the trochlear groove and grinding that joint. Okay. If it hurts, the sign that maybe the patellofemoral joint is irritated. Okay. Palpation is also helpful in folks with patellofemoral pain. So if they have a little tenderness around the kneecap, that's a sign they might have some patellofemoral issues. Just keep in mind, if you're having tenderness above or below the kneecap, that's a sign you might have some quad tendinopathy, maybe some patellar tendinopathy, and not necessarily patellofemoral pain. Okay. If you notice excessive patellar gliding, so if there's a ton of joint play, that's a sign, in the patellofemoral joint, that's a sign that this individual may have some patellar or trochlear groove morphology that's going to predispose them to instability within that joint, which may create some more pain. Okay. And again, this is a diagnosis of exclusion. So for these folks, you want to make sure you do a really good job of differential diagnosis. Is there a lot of swelling? How's your range of motion? Is there any joint line tenderness? Have you gone through some of your ligamentous tests? Have you gone through meniscus testing? Are they all negative? If they are, good sign there's patellofemoral pain. Do we need imaging for patellofemoral pain? Generally not. So we usually don't learn much by getting an MRI or an X-ray. It may be indicated if someone is not progressing. We can figure out maybe what's going on a little bit further. But generally speaking, this is not a condition where you need imaging. Another thing to keep in mind is that we've done quite a bit of research recently about psychosocial factors in folks that have patellofemoral pain. So in folks that have patellofemoral pain, especially severe cases, you'll find kinesiophobia. So these folks tend to be fearful of movement. They can also have some anxiety, depression, and maybe some catastrophizing. So believing that their knee pain will never get better, or they have this bum knee, like I said earlier, right? So it's important that we educate folks on the prognosis of patellofemoral pain and that they can get better over the course of time. Now, do these issues, these psychosocial factors, correlate with the onset of pain? So we've got some research, at least in the low back, that things like depression actually do correlate strongly with a new onset of pain. We don't know this yet for patellofemoral pain. So it could just be that you get patellofemoral pain and then these things occur afterwards. That makes perfect sense. If your knee is killing you, you might be depressed about it, right? You might be scared to move because anytime you move, it hurts like heck, right? Or it could actually be that these beliefs will lead to patellofemoral pain. But that's yet to be seen. Needless to say, it's probably important that in part of your treatment, at least, you give these guys some hope, let them know it's okay to move and give some guidance on how to move so you can reduce some of these psychosocial factors that might be keeping them in pain, right? And keep them from making the right decisions from a rehab standpoint. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain Free Mini Course. Definitely check this out.